Welcome everyone to our Safe Together, Strong Together Return to Campus information session. I'm Dr. Amy Bronson. I'm the Physician Assistant Program Director here and also have had the tremendous opportunity to work alongside John Marshall in helping to co-chair our Safe Together, Strong Together initiative and planning for a return to fall this campus.
So we're going to start today by reminding people about some of our web resources. This information can really help navigate the high volume of information that we're communicating on almost a daily basis. You can see here on CMU's homepage that the return to campus information is front and center. From here you can watch a return to campus video, or you can click on the left and see our Safe Together, Strong Together plan, or clicking on View to Plan. Once you are on the return to campus main page, you can review a range of materials that will inform your own return to CMU. On the left-hand column, you'll see information about testing, our new symptom checking app, a guide for returning employees, general updates, federal assistance info, and of course, our frequently asked questions link. So if you go to that FAQ portion, this section of the site is updated daily as we acquire new information, and as everybody knows, that seems to be a pretty frequent occurrence. From testing and academics to athletics and returning to work, we are posting information here as we receive it and as we find answers to your questions. Now we're back on the return to campus main page, so let's take a look at the report. Click on the ST2 Interim Report, and here is a page of our Safe Together, Strong Together report. It gives you a sense of how we're managing our response to COVID-19 since the beginning of the pandemic back in March until now. One thing that stands out is our outstanding medical team. So let's visit that information for just a second. So here you can learn about the medical experts and the public health agency supporters who are working with us every day to ensure that our plan is a good one, is sound, and that we are answering questions to the best of our ability with the input from outside experts. Dr. Yumi Lee at Community Hospital, Erin Menerath at St. Mary's. Erin's role is the infectious disease prevention specialist at the hospital, so literally this is her job every day, is how to prevent the spread of disease like COVID. Dr. Yumi Lee, also an infectious disease expert at Community Hospital. Really appreciate that. And we have more than a dozen professionals that have been helping to advise our efforts. So all that said, quick intro past, I think probably the thing that has been the topic of the week and whatever's on everybody's mind is testing. So let's talk a little bit about that this week. How's it going out there?
Yeah. You were highlighting our community partners, and I think one of those community partners that's really important to highlight is Mesa County Public Health. And we really took our testing strategy and knowing what this testing solution could look like for drive-up testing and being able to scale up to test a whole lot of people in a small amount of time from the efforts that they had already done. And so I'm really thankful for Mesa County Public Health and what they've done. They were actually on site today to check out what we've been doing here on campus, and very thankful for their input in allowing us to be able to do what we have already done on campus. Yeah. Do you want to give a few details on what it's looked like since Monday?
Yeah, so as it turns out, the university has never really done mass testing of thousands of people before, so we're learning new things every day. Monday, we got off to a pretty good start. We got several hundred people through here at the Grand Junction site. Both the Colorado Springs, Denver, and Fort Collins sites have been moving students through as well, based on the metrics I'm looking at. We have now tested, as of earlier today, I think something like 1,200 people already this week, so a pretty good start thus far. I do need to point out we have some areas have gone really well. The Grand Junction site, the Denver sites, I think for the most part have all flowed very quickly. Resulting has already started to come back and is turning quickly. We have had trouble with the mail home test kits. This is something that we're learning as we are going with our lab partners and our friends at FedEx and others, but we have had some trouble, and so there's a few of you out there that we've struggled to get those delivered on time. We've been troubleshooting over the last 48 hours. We think we've got some solutions in play, and as of this afternoon, our belief is that most of those are going to be resolved. If you've had a mail kit test problem, send us an email at safety@coloradomesa.edu. We've got a couple of folks that are experts in this area that are working actively to solve them. But I do want to point that out, that we have had some trouble with those mail test kits. Even though it's not a lot of test kits, those are important, and those students out of state are relying on those. So we're going to stick with us. We're going to get that resolved, and we'll get them out to you.
That's right. And we do have a team of folks that are responding to those testing questions as quickly as possible. So as John said, if you have an individual question that has not been addressed, go ahead and send us an email at safety@coloradomesa.edu. And we are trying to be as responsive as we can to any of those questions that are flowing in around testing. We heard you. We heard you loud and clear that some of those testing sites in Denver were quickly filling up with appointments. So I think we've addressed all of those issues, but this continues to be a learning process. So thanks for leaning in with us as we continue to learn more to make this process easier for all of you.
So we are on the first week of a 3-week pre-semester testing. And so that baseline testing, as you've talked a lot about, Dr. Bronson, will really allow the university to see what the prevalence rate is among our population. So it's really important. If you have not already done so, go sign up for your test, get that taken care of. It's quick, it's painless, and there really should be no trouble. We have had a couple of questions on what if it's easier for me or it's more convenient for me to go get a test at my local agency or my local doctor's office. That's fine. A week ago when we sat here, we were not entirely sure how we were going to source those. As of today, we've solved that problem. We are going to be adding a link later today on our FAQ page that's going to allow you to click on that. It'll ask you a couple of quick questions. You'll authenticate through MapZone, of course, so we know it's you and it's private. You'll ask, when did the test happen? What kind of test was it? And then it'll allow you to upload an image or a PDF that will allow us to see those test results. So if you decide or have already decided or have already tested with your private doctor or your local health agency, you can upload those results as of later today. And as a quick reminder, what kind of test is acceptable?
Yes, it's a great question, and make sure that you're getting that antigen test. So there is both an antigen test out there and an antibody test, and to make sure that we're being as specific as possible, we really want you to get that antigen test. The one that we are doing at our testing sites, both here on the Front Range and those at-home kits, are all the anterior nasal test. So that means it's just a swab in the anterior, the front part of your nose. That test kit goes in, and we're able to run that antigen test. The antibody test is one that you will have to do a blood draw for, and that is not one that you need before you come back to campus. So we really just want that antigen test done prior to coming. There are different collection methods for that antigen test. If you have questions on whether or not that test that you're looking at will qualify, certainly send us an email. We don't want you to go and get a test that isn't going to meet sort of those qualifications and requirements. So most places, as you are going to get a test done, if you simply say, I just need to get an antigen test, most will know exactly what test you need to have done in order to be able to come back here to campus.
So if it's a blood test, it's the wrong one.
It is. If you're getting a blood draw, you're likely getting an antibody test, and that is not the one that you need.
Got it.
Yep.
Okay. So the continuous improvement process, we've been getting better every day at this. As we said, the resulting is already happening, and that's been turning in under 48 hours thus far, which is really great news. We're crossing our fingers that continues and that we're able to result those really, really quickly. So that's been, I think, one of the shining moments of the week, right?
Absolutely.
We've been really pleased about that. Mm-hmm. So we're working on this pre-semester testing, but right after that happens, right, come the first day of classes on the 17th, we're going to pivot back to a surveillance testing process. The surveillance testing process is really our attempt to both identify and isolate positive cases on this campus. We know we're going to have positive cases, and of course among young people they tend to be asymptomatic. We've already had a positive case this week, and a student who feels fine, didn't know they had it, they're asymptomatic. We anticipate that there will be more of those as the semester wears on. So the surveillance testing, come the first day of classes all the way through Thanksgiving, is really built around this idea of trying to randomly test all pockets around campus to try and proactively determine, once we all arrive safely, once we've all tested negative, to ensure that we're tracking within the campus population that the virus is not here and is not spreading. And when we do identify it, we want to then quickly isolate and initiate those protocols to keep everybody safe and to keep it from spreading.
Absolutely. And I think it's important to point out that we know random sampling is not everyone across campus is going to be tested every day, but it's really the statistical modeling that we've had some really thoughtful, very smart people way beyond my pay grade that have taken all these numbers and figured out with all these charts how we can predict how many we need to be sampling across campus to ensure that we have a really good idea of what's happening with COVID on our campus. And just like you were saying, John, how important it is that we identify those quickly, because we have said from the beginning, we are not trying to keep campus free of COVID. We know that there's going to be COVID here, but what we can do is we can figure out where it is, be virus detectives, put in strategies to be able to mitigate and to be able to contain it and keep it from spreading across campus.
Absolutely. So that surveillance testing is one of several methods that we'll use to keep the campus safe through the course of the semester, week in and week out. This is kind of an accumulation of many different strategies, right? We've talked a lot about the fact that there's no silver bullets in putting a stop to this virus, but rather it is a series or an accumulation of risk mitigation strategies. So talk to us a little bit about the contact tracing and that team and how that's coming along this week.
Yeah. So as we talk about getting those tests done, we know that that is one really important element. We have to have the testing in order to have an understanding of what COVID looks like on campus. So let's say we have a positive result here. We have a team of folks here on campus that have actually worked alongside Mesa County Public Health and our epidemiology team there to really set up a training that's going to allow for us to have our own virus detectives here on campus. Why is this important? It's a tool in the world of epidemiology that's been used for years. And I kind of like to think about it, if I were an epidemiologist, this is a little bit like your Super Bowl. Like this, you prepare for this, you're training for this. And although it's really overwhelming for us to think about transmissible or these communicable diseases, these are folks that are really trained in order to know how to respond to this. And so working with their team, we have some folks here on campus, some really dedicated faculty members who have taken this on to create a course to help train folks here on campus that are going to be able to know when we have a positive case here on campus, be able to reach out to folks that may have close contact. The CDC has really defined close contact of someone that I am in a close proximity to, meaning less than 6 feet for greater than 15 minutes. And we know, because of what we know about the virus, even though it's novel and new, there are some things that we know about virology or the science behind viruses to know how it's transmitted. And so knowing that it's in respiratory particulates and it's held in the air, we know if we're keeping that 6 feet of social distancing, we're likely pretty safe. So even if I were sick and I was coughing or sneezing and you were in a greater area than 6 feet to me, the likelihood, there's a pretty low probability that you would get sick. And so when we're reaching out to folks that have potentially had close contact, that's really how we're defining it. And that's really what our contact tracers are going to do. But I think the important part is not only the personnel piece, but the app piece and how technology sort of meets personnel.
Yeah. So, one of the things that we have been pushing really hard on in this spirit of continuous improvement is trying to get ready to go as students arrive with our app that's going to be ready to support our student body and our faculty and staff. And the app is really serving two functions, right? The first function is as you're working on contact tracing. So if a result comes in, and we've begun the regular semester surveillance testing, let's say Dr. Bronson is selected this week for random testing. You go in, you feel fine, but you test positive as an asymptomatic person. Well, now what? The app is going to allow us to do some immediate notifications, which is really, really useful. So even if a person is not immediately on the phone with you, you get an immediate response, but we're also able to make that phone call. And then it allows you to then start working through, well, who was I in contact with, to try and keep the rest of the campus safe. And so it will allow you to upload some of those contacts that you might have had. If I have, my roommates or, somebody that I've been studying with a lot or some of those things. Now, we're trying to keep these family units or these Mavely units in these tight groups, right? But the contact tracing is really there to, again, make sure that we quickly and accurately figure out what, if any, exposures somebody might have, allows that team to quickly, within hours, not days, reach out, isolate, and make sure that until we can fully test, make sure that we can fully contain that, that we're able to track what's going on. The other element that it does, of course, as we think about checking our symptoms every day and how we're all feeling. We know from the early research that everybody sort of monitoring their own symptoms, I've got to do that, you've got to do that. How are we feeling each day? And this app is going to allow us to kind of log how we're feeling each day. And if we're starting to experience some of those symptoms, a fever or say a cough or something that we know, according to COVID, if we start to experience those, it allows us to log those things. And then it's going to allow the university to resource you and provide you with the kind of support you need, make sure that we get a consult with a medical provider, and all the various dominoes that fall if we start to feel ill, right?
Absolutely. And I think it's important, as we think about daily symptom checking and really checking in and, asking the question every day, how am I feeling? It's important to know we understand that there are folks with chronic conditions, chronic medical issues, that they may have some of those symptoms that could be considered COVID related. And we're really asking for folks to think thoughtfully about, is this a new symptom? Is this something new that I'm experiencing? And if it is it something that could potentially be COVID related? And how can we help support you to ensure that you stay safe and healthy while you're here on campus? And so I think that's
so
really
if I've got chronic headaches, for instance, Dr. Bronson, that's not something we're trying to pick up here, right? We don't want to necessarily know if you've got daily headaches. What we really want to know is, are you experiencing something out of the ordinary, something new that falls in that category of COVID-related experiences? Okay.
And as we talked about the layers, I think that's the symptom piece too. You may have chronic headaches, but maybe this headache's very different and I have a fever.
Yep.
So that's really what that app is helping you to do, is just to think through your symptoms as you're checking those daily.
So one of the symptoms that we know is fever and having an elevated temperature. So one of the positive steps forward this week, our IT worked with a third party to install now and we're operational as of this week, these thermal scanners. Meaning it's basically a temperature check, but it's at a safe distance, and it doesn't require another human being to take it. So it's just on a little iPad. You're able to quickly take your temperature, and it's one more tool to keep us all safe. So I can check my temperature really quickly and easily in a non-touch way. And those will be posted a variety of places around campus. But important to recognize, the on-campus residential population, of course, is going to be our primary concern. These students live together, they live here, and so they're going to be a higher risk population, and we're going to want to make sure that we are checking temperatures of everybody coming and going out of residence halls, coming and going out of the dining hall, coming and going out of the rec center, and then we'll put them periodically around other academic buildings. But good news, we got those installed this week, so one more of the many task lists checked off this week.
That's right. And I think when we're talking about the layers, this is just another tool, and we really want that to be utilized as a tool. We know for those living on campus, going in and out of your residence hall, it's an easy daily way for you to sort of make that check mark of, yep, I'm feeling pretty good today, no temperature. But for other of us across campus that don't live here, this is just another tool that as you're walking into an academic building, it's easy to give you a little bit of feedback on, yep, my temperature was this. And it's great to be able to know that, because
quick and
I think it's
easy.
just another quick and easy way for us, as you think about going to get your coffee in the morning, as you're walking through the building. It's just another tool that we have to be able to help you do some of your own symptom checking.
Yeah, that's perfect.
Yeah.
It looks like questions are starting to flow in, so maybe we'll just transition into the Q&A if that works, Dr. Bronson.
Absolutely.
So the first one, and I'll take it, looks like from Jada, about is there an updated handbook on for the residence halls this year? And the short answer is there will be an addendum at the end of the Maverick Guide that'll publish this weekend, as our first students are moving in this weekend. And it really just is an addendum specific to COVID. Let me summarize for you what this is going to tell you in terms of your expectations on campus. You have got to abide by safety protocols. We all do. The only way that we can come back together as a university campus is if we're all playing by the same rules. So that's going to be wearing a mask indoors. That's going to be taking the COVID 101 course. So if you're a student right now and you haven't taken that yet, log into D2L and take that course. It's a great informational course, and it's going to prepare you for being smart, making good choices, and being a responsible member of our community this fall. It's going to require that you test, right? There's a series of these requirements that are just going to be part of the deal, being part of the Maverick family this this fall. So you can take a look at that. We're going to hold you accountable to that. And so you need to know that coming in. There's going to be different requirements this fall. We think it's going to be a great fall, but it is going to be a little bit different. And you'll be able to find those data in the back of the Maverick Guide that'll be published this weekend.
Yeah. Another good question we got from Ben is what happens if a student contracts COVID after they've received a test? And I think it's important to understand with the antigen test that it really gives us one snapshot in time. This is not giving you sort of a clean bill of health to know that you're not going to contract COVID while you're on campus. What it really says to us is you don't have COVID in that moment of time. And so when you're coming back to campus, we have a little bit more security in knowing just a little bit about what people, what that looks like on campus before you come back. I think the important piece is, though, that means that you need to continue to do those things that we know that are going to be preventative, like wearing your mask, social distancing. And if you were to get sick, let's say you're doing your daily symptom check and some symptoms pop up that are new for you and you end up going to our Student Wellness Center because you are symptomatic, this Scout app will kind of help you navigate where to go next. And you go and get your test done and it comes back and you have COVID. We have some isolation and quarantine protocols as well as some support here on campus to help you through that. Do you want to talk just a little bit about that support infrastructure that we have built in around that?
Yeah, absolutely. Because I think one of the things that we have to assume going into this fall is that we are going to have some folks get sick. We are going to have some folks be positive for COVID. And so we're anticipating that. We've secured a number of beds off campus, and we have some beds on campus that'll be available specifically for this purpose. We'll also have nurse care to those rooms as students are isolating. And we've had a really great conversation with our faculty this fall about how is it we're going to accommodate students as they have to be gone and isolate for 10 days. So don't panic if you wind up being positive, if you wind up being ill. We've thought about this, we're prepared for this, and we're going to work with you as if you've got to miss a little bit of class. We're going to make sure you get the chicken soup and Gatorade that you need to stay healthy, and we're going to make sure that your faculty are working with you as you're absent if that need arises.
Absolutely. And I think as a parent, one thing that I would want to know in having my child come to CMU is also not only internally what do we have, but externally what do we have here in Grand Junction that's going to ensure that we have the safety protocols and infrastructure to respond to any child or student that is sick. And I think part of that has to do with the medical regional center that we do have here. So not only St. Mary's Hospital, which is a regional medical center, but community hospital, we have a VA hospital here, and we have a really robust county health department too that are all standing with us in this with a lot of bed capacity in their hospitals and a lot of an ability to be able to respond. So not only our partnership with community hospital and the Student Wellness Center here, but the greater infrastructure of the medical community here also imbues a lot of trust for us in our ability to be able to respond.
Yeah, I'm glad you brought that up. It's one of those topics that the state of Colorado looks at when they look at all the various individual counties and how that county is doing. And the reality is what they're looking at is what does that 2-week prevalence rate look like? How active is the virus in that county? In Mesa County, that's continued to hover in the low to mid 2% range, which is dramatically lower than most other counties. So we're really blessed that we have a very low prevalence rate of the virus here. But to your point, that's coupled with it's not just how this low prevalence rate of the virus, it's also the fact that we have this really robust infrastructure in case people do get sick.
Absolutely.
And we're really blessed to have that. So it's a great reminder.
I think there's been some more questions on this idea of surveillance testing and sampling. How many are we going to sample every week? And
oh, sure.
What is that going to really look like?
Well, for those of you that are statistician nerds, we're trying to shoot for a 95% confidence interval across all the various populations. But as you also appreciate, not every population is equally as active on campus. So when you think about residence hall students, say a marching band, say a choral ensemble, or a football team, they're all going to have different kind of exposure risks. And so there will be certain populations among our campus that we're going to oversample. But big picture, we anticipate about 250 at a minimum every 2 weeks. And what that really breaks down to, if you kind of do the math, is about 20 to 25 tests per day on campus. And that's going to give us a really good rolling average view. And if we can hold up our testing resulting, continuing to turn in a very short amount of time, really gives us a nice, accurate, real-time picture of prevalence across the university. So we anticipate that. We're also looking into a couple of additional things. And for those of us that are kind of reading about this stuff in the news every day, there's a lot of testing going on. The science is sprinting to catch up with this virus, and so there's a variety of things we're looking at in terms of testing tools that might assist us in that surveillance. Maybe you could talk to us about a couple of those potential, not yet confirmed, but
Absolutely.
potential tools we might be able to use this fall.
Absolutely. This is where I love scientists, because they're always coming up with something new that's going to give us more data, which is great. But wastewater testing is one of those additional surveillance tools that we're looking at potentially implementing here on campus. So what we know about the virus and what we know about how the virus sheds is it's not only in the mucosa and our respiratory, but we also shed that virus, and this may get a little gross, but in your poop. So we do know that by surveillance of wastewater, we can actually look at viral loads and how much DNA, RNA is potentially there, and we can test that for COVID as well. And it gives us another really good idea, specifically in places where there's a lot of people living in close spaces, like residence halls, potentially what is happening. So it gives us a really quick landscape or climate of what's happening in that residence hall, and can help us respond really quickly and increasing potentially our own surveillance and random sampling that we're doing. So just another strategy and tool.
One more tool. So, and there's others I know, pooled testing and these sort of LAMP assays and a variety of others that we're continuing to explore with our partners. The University of Colorado, Colorado State University are both looking into this carefully, as well as a variety of private labs that are all, again, just sort of sprinting in the middle of this science. So we're going to keep working with those partners. We've got folks even coming onto campus next week to keep exploring this. So we will keep you up to date on those technologies.
Absolutely. And I think with the testing conversation, we do feel like it changes daily, because the science and literature is really changing daily. There are new breakthroughs that are happening all the time, from saliva testing to testing that is essentially point of care, almost like if you think about a pregnancy test in a very similar way. And so we are learning so much every day. And I think the nimbleness of our plan, and I think the institution support behind figuring out the best strategy, is that we have sort of been charged with, let's stay on the forefront of what's going to give us not only the results, but the results in a quick enough time that we can really respond to things quickly and adequately, and to be able to contain the virus here on campus.
One of the questions it looks like here for me is about what looks to me like a travel question. And I think we are looking at, and in consultation, I should say, with our various public health agencies, not just in Mesa County, but if you look at our region, Montrose County, Delta County, Garfield County, there's an area here that we've got great partnerships going back many, many years with our local neighboring counties. And so one of the things that we anticipate is being able to kind of isolate that region rather than kind of the immediate borders of Mesa County, but really look at this as a region as we ask students to stay within that region, stay within our area, and not travel outside of that, because we know that those neighboring counties have very similar kind of rates. So we're in the midst of that protocol, Mia. I think it's a good point. We know a lot of students are traveling in Montrose and Delta and Parachute and other local towns that are a little bit outside of where we've hoped. And I think what we're developing is a protocol that will allow a kind of area view of what our travel protocol would look like. So stay tuned. I think we're anticipating this kind of as an area, as a region. We're going to ask you to stay within that. I know the initial guidance was Mesa County, but we are actively chatting with our public health partners about what that looks like.
Absolutely. And I just want to remind folks, we're getting some really great questions. If you have something that's really specific and potentially is a very personal question, please reach out to our team. We will follow up with you directly, just so that we don't have to sort of put out there any specific things about you and your situation. So if you have something that's really specific, we do want to address that. We do think that that is important. And if we are not able to address it, our team will either reach out to you, or please drop us an email at safety@coloradomesa.edu. And we will get to those questions, because those are important.
I see a question about our overall medical staff. I think we've chatted about the overall health infrastructure here, but the student wellness is in partnership with community hospitals. So let me just be specific. What are the resources the university has to respond to somebody who is sick? The answer is a lot. And in addition to all the various PPE and all the various cleaning and safety equipment and things like that the university has procured. We also are in partnership with those healthcare partners, and so we then turn around and multiply that by a order of magnitude and have access to all the various healthcare apparatus that those partners have.
Absolutely. We got a good question about the academic calendar and wonder about, are we returning to campus, after, before Thanksgiving, after Thanksgiving? What's happening with our academic calendar? Maybe we can kind of speak to that broadly.
Yeah, so we've tried to be as simple as possible about this. We're starting on August 17th, and we're going to stop right in front of Thanksgiving. So the plan is, stop. Let me be specific with my words. We're going to stop face-to-face in class, and we're going to come back after Thanksgiving, but we're going to do so distance and virtual. So there's 1 week of class after Thanksgiving, that'll be virtual, and then final exams, and final exams will be virtual. And really the idea here is that we know students are going to travel all over the country after they go home for Thanksgiving. We all want to go home and get some pumpkin pie and hang out with mom. And the point is that in order for the university to minimize risks, we're going to just finish up that last week of instruction online, and then we'll have final exams.
Yep. And I think it's important to emphasize, just as we are all coming back here on campus in the first early weeks of August all together,
Yep.
we really do emphasize that piece around travel and traveling outside the region, because what we know is we have had a low prevalence level here in Mesa County, meaning the amount that we're seeing of COVID that's been transmitted in the community, although maybe rising a little, we also know we're testing a whole lot more. And so even though we're seeing a few more cases, we also know that we have a little more widespread testing here in the county, which is good. But it's a lot lower than it is in other places in the country, and we know that. And so part of our privilege of being able to come back on campus together is also being willing to say, yep, if we travel, we're also maybe putting the rest of our Mavely at risk.
Don't do that.
Don't do that.
14-week sprint. That's
right.
what it comes down to, from August 17th up through Thanksgiving. Please don't travel. Stay here. It's going to be a great semester together, but do not travel during that time period, please.
Absolutely. We've gotten a few questions about the Montrose campus. Maybe it's important just to talk a little bit about, what is happening at the Montrose campus and how does that integrate with what is happening with our plan here on our main campus?
Yeah. So first things, let's put on the table. We were not able to stand up a testing site alone in Montrose. I will say, both in a positive but in humility, we are pretty maxed, pulling off the Denver sites, the Grand Junction site, and the mail home kits. We simply weren't able to pull off a Montrose test. So we're asking Montrose folks to drive down as we are. And let me pause for a minute. I wonder if we might pull up the map on the testing page on screen for a moment. That map gives you a sense by county what we're asking you to do. Now, this was something we worked through with our labs, and we really tried to be thoughtful about, but we appreciate that if you're in Jefferson County, it's a little easier to reach than if you're in a different county, for instance, on the Front Range. So some people are driving 10 minutes, some people may have to drive a whole hour. We appreciate that. We're trying to be as responsive as we possibly can, and that's why we set up, the Northern Colorado, Southern Colorado, Denver Metro, and Grand Junction sites so that people can access a test in fairly short order. But we recognize there is a little bit of a drive involved there. So refer to that map, make sure you understand kind of which county you're in, and if you've got some kind of hurdle or something that's causing a barrier for you, send us an email to safety@Colorado Mesa, and we'll get you a mail home kit. I will say we have not a lot of those, and so it'll be important that if you're within a reasonable drive of one of those test sites, please utilize that resource, drive down there, or use your primary care doc, use your local health agency, and then upload your private third-party results.
Absolutely. And we also appreciate the comment that the campus looks beautiful. It is great weather here. Can't wait to have you all here. But some folks have seen, hey, there's students walking around on campus. Maybe we can talk just a little bit about timeline and who's coming back on campus and how that's happening and what that's going to look like as we ramp up towards the beginning of fall. Yeah,
the rubber's hitting the road. So the resident assistant students and senior RAs are moving in this week. They're starting their training. We'll have some of our early athlete check-ins this weekend who start then those freshman athletes who will start their early FYI program. And then come the following weekend, which is the 8th, 9th, 10th, somewhere in there. I don't have my calendar in front of me, but that following weekend, I think, is the 8th. We'll bring on our next round, which is the bulk of our freshmen coming in with our freshman year initiative or our pre-semester program. And then, of course, 13, 14, 15 will be the lead up to the final weekend where the rest of students will show up on campus. So we're excited to welcome everybody back.
Oh, yeah.
It is going to be really good to see everybody again. We haven't seen all of our students since March. And maybe to state the obvious, but a university campus is built for students, and we've missed you guys, so we're excited to have students back.
Absolutely. Can't wait to feel the energy and
Absolutely.
Yeah, feel the excitement as we welcome folks back.
Yeah.
So looking forward to that. You know, one of the questions that I have seen and I've heard kind of around campus is if we know that there's the potential for folks to get sick, what's going to happen with courses if I get sick and I can't go for a couple of weeks? And maybe it's time we talk just a little bit about all the work our faculty have done to be prepared for what that may look like.
Yeah, I think, you know, if you imagine yourself as a history professor like a Dr. O'Rourke or somebody that they really love their lecturing, that's kind of their bread and butter, they love doing that kind of work. Things have changed for them too, and so what they're now having to accommodate is a variety of tools like masks. They're going to have to deal with a classroom that instead of 50 or 60 students is now going to be 30 or 40 students, and is just going to require some different approaches to try and reach everybody, try and make sure those lectures and that in-class learning is happening in a safe way, but is also happening in a really robust way. And so they've really spent most of the summer trying to adapt their classes and prepare for this new reality that we're all facing. And so a lot of hybrid work, right? A lot of pre-recorded lectures, a lot of different adaptations, is that the right word?
That's it.
Adaptations to make sure that these classes are both responsive and flexible and are going to allow students to really learn in the classroom under what's going to feel a little different this fall.
Absolutely.
Yeah.
And I think as someone who loves to teach, you know, I think in times when we have to face change, there really is a chance for innovation, and we have seen that happening on campus. Seeing faculty members who have been very thoughtful around how this is going to look and how they're going to continue to engage folks that are in the classroom and also online, and how we change activities and modify them, but that you're still getting the learning opportunities. These classrooms are going to look a little bit different.
Yeah.
You know, we're going to have 6 feet of distancing, so I'm not sitting right next door to my best friend. But what you still are going to get is that one-on-one faculty interaction. And I think what we heard from folks when we did the survey was that, you know, online education's okay, but what we really enjoy is that interaction with our faculty members, because we know it's not just about knowledge transmission, but it's really about becoming different people because of those that we get to interact with in the classroom. So even though the classroom will look a little different, you're going to be able to wipe down your space before and after use. We're going to ask you to wear a mask. It's going to feel a little bit different. You're still going to be all in with your faculty members and other cohort members that you're going to those classes with. And I think the learning, as long as we choose to engage in it, will still be really rich and meaningful. Yep,
we're excited to engage in that. And as you said, you know, every time you have a challenge, there's always opportunity in that. I see a question here about the plan if there were an outbreak on campus. So I think maybe great opportunity for us to refresh everybody's memory on the way we're working with Mesa County, how they're staying up to date on this, and maybe even we could chat a little bit about how we're going to be resulting tests and positive tests and things like that.
Yeah, really great question. And I think it is important to highlight that we could not have done this alone. Really, it's been our external stakeholders,
Absolutely.
Our medical and health advisory team that has given us hours of volunteer time every week, sometimes daily phone calls, sometimes multiple phone calls in a day, where they volunteered their time and expertise to really not only vet our plan, but to give us really better solutions for moving forward. And as we continue to move forward with that, that's going to continue with our weekly standing meetings that we have with this health and advisory team from St. Mary's Community Hospital, Mesa County Public Health, that are really continuing to give us guidance every step of the way. So as we like to say, we put a great plan out there, but we also feel like and know that that's going to change a lot as we move forward.
Yeah, and one of the ways that you will know as a student, as a parent, as a community member, as a professor, how are we doing on campus? So right now, if you were to go to the state of Colorado's webpage or your home county, and for us, Mesa County, you can go to any one of these public health agencies and you can see in real time the resulting test data. So we are right now building out the same functionality on our website. So you'll be able to see really quickly and easily how many tests have been accomplished, how many positives have occurred, and what's our overall prevalence rate. And the good news for us is we don't have to invent these thresholds. Public health has already pre-established those. So CMU won't be in a position where we're guessing at, well, should we do this or should we do that? These are all trigger points and metrics that we've established in advance. And so you, as part of the CMU community, we all will be able to see that in real time, day to day, as we result these things. And if the prevalence rate starts to grow, things will start to change. And there is a final trigger point that Mesa County has established where we would have to move away from that in-class learning yet again. But I guess I remain optimistic that all the things we're putting in place, and we all now know, having gone through this in the spring, what a privilege it is to be here, how excited we are to be back with one another. And so my hope and my belief is everybody's going to take that extra measure of care, that extra measure of ethical behavior, and make sure that we're all safe and following these protocols. And so as we are able to kind of see how we're doing, that'll allow us to all to kind of be reinforced that those behaviors are working.
Absolutely.
And we'll know that in real time.
Yep. I think it's really easy because we have been so close to this for so long to forget the bigger picture and the why of why did we even take on this process in the first place to say we want to come back to campus. I wonder if you just indulge me a little and talk just a little about why did we even take off on this in the first place to try and come back to campus safely?
Well, you wouldn't be crazy if you said just hit the easy button and go online. But I think you have to pause and reflect on what is CMU's why. The reality is that we have always been an institution that's about helping students who are first in their family to go to college, students who are low income, middle income students, students who haven't traditionally had a college degree. And what we've learned over many years and was reinforced really specifically this spring is that that online experience was just not what we know our students need. And so if you pause and think about, well, who are the inventors and the caregivers and the teachers and the folks who are going to really take us into that next generation, it's our students of today. And we owe you, students, that opportunity. We need you to step up and be those leaders of tomorrow. And the only way that happens is if we have the courage to continue trying to keep this educational opportunity moving ahead. So that's what we're doing. We've spent literally thousands of man hours, hundreds of people across this campus trying to prepare a great plan to bring you back here. And so the why is really simple. We love what we do, and your education matters a lot to this country, to the state, to this community. And so we're going to give it our best.
Absolutely. And I think it's one of those pieces where we look at it and we know that, as much thought that we put into this, there is going to be iterative changes. And I think it really comes down to it's going to take all of us signing up to say that we're willing to make some small changes in our everyday to make campus safe so that we can stay here and continue to do this together this fall.
Sounds good. So it looks like the questions are continuing to pile up, but I think as we think about the next 10 days to 2 weeks in this final lead up to campus, I would just continue to urge you, if you have not signed up for your test, do that. I think we have about half the campus and half our students that have already selected a time, scheduled the test, and already gone ahead with that, but about half of you haven't. So take a moment, go to the testing site where you're going to get some additional pings, you're going to get some emails and text messages to continue encouraging you. But go to our website, and under the testing FAQs, the very first FAQ is a question about what happens if I deleted my email or I ignored your text. How do I schedule a test? That very first question is going to allow you to click on a link. You simply enter your 700 number in, and that will allow you to schedule a test. So if you haven't done that, pause right now and do that. We need you to take care of that so we can get those scheduled. We got a lot of tests yet to go here in the next 2 weeks, so do that. Please keep an eye on your email. We're going to communicate a lot with you. If you're a residence hall student, if you're a commuter student, doesn't matter. We're going to be communicating a lot of information because a lot of things have changed. We need you to be active learners. We need you to be actively engaged in these conversations. And if you have a question, reach out to us. holler at us. We'll get back to you. We're getting a lot of questions. Volume's pretty high right now. So if it takes us a couple of days, be patient with us. Maybe even send us a reminder. We've got a whole team of people that are actively working through emails and phone calls every day. So we will get back to you. Just be patient with us.
Yep. And I think the teacher side of me also wants to put in the plug for if you haven't finished the COVID 101 course,
Yep.
please do. That has a lot of information in it that's going to make us all really successful when we come back together again. So if you haven't taken that course, please jump in. There's some good content in there that's going to be really, really helpful for all of us as you come back to campus. We know there are a lot of questions that we were not able to get to today.
Yep.
So we will be following up with folks and certainly answering those questions as they come in. But if there is something in particular, again, that's very specific to your situation, please email us at safety@coloradomesa.edu.
Mm-hmm. We've heard from you that this format has seemed to be a good complement to the other things we're doing, so I think we're going to try and hold another one of these next week. So keep an eye out for that. We're also going to have a Teletown Hall meeting, and what is today? Thursday. So tomorrow night,
That's right.
President Foster is going to host this, and we'll have some other folks there to help answer questions. But again, a Teletown Hall, and I think that's going to be tomorrow after work, 5:30 or something like that. So if you get a phone call from a 970-248 number, go ahead and pick up. It's not spam. It's us telling you what we're doing on campus. Just one more opportunity to continue talking about this. Make sure that you're abundantly clear and that you have gotten all your questions answered heading into fall.
Absolutely. And we are excited to come back again next week, and we know we're getting a lot of questions about the app, and we're excited to tell you more about technology that we'll have here, and just excited to hear more about what questions you may have. So if you have something, send it our way, and we'll try and address it next week.
Absolutely. So with that, thank you for your time. Thank you for being patient with us. We're all in this thing together, so we appreciate you sticking with us, and we're excited to see you here shortly. So we'll see you next week, and I think from there we'll sign off.
That's right. Thank you.
Good afternoon.